I hereby call the Health and Human Services Committee of the Marathon County Board of Supervisors to order. Thank you all for attending today. Item 2 is the public comment section on the agenda. We do have one call-in user who has requested to speak. Amy Litzer, you are up. If you could state your name and address, please, for the record, and then feel free to speak.
Okay, Amy Litzer. I reside at 500 Grand Avenue, apartment 408, Wausau, Wisconsin, 54403. I just wanted to briefly speak on mass transit. Mass transit should be available in for all disabled students, workers, shoppers, and all of our medical clinics in our local Wausau facility. We should also work to make sure that we provide what becomes of our local Marathon County parks and events year-round, including cities and local municipalities as Vermont, Rochelle, Schofield, Weston, Mosinee, Merrill, Marathon City, Edgar, and all other local places that are considered communities here around us. If we want to do that, we have to all contribute to the cause. And if everyone contributes, it would make the price come down, and it would really generate more business, more income, more jobs, and be greater for everyone else. Vermont is becoming the new hub, and we have to accept that. And it's going to become that in the next couple of years. I also wanted to present this to the committee. There are 3 bus drivers that are currently with Metro Ride that are becoming a little bit of a problem, and they are scaring away customers that I've noticed. That is why Metro Ride is losing passengers, and they fail to not notice this problem. But yeah, for right now, that's all I have on that. But other than that, I have noticed a lot of passengers from my building have become not wanting to ride and have fear of getting on the buses because they're afraid of getting injured, being trapped in the bus. They have panic attacks with certain bus drivers. They have had physical symptoms when they come home, and they have talked to me about accessibility problems with the buses and the lack of control that has caused anxiety with them, and the current issues going on with COVID and the current new COVID virus that was just announced this last week that we need to address. Thank you.
And thank you. Are there any other public comments from anyone online? All right, seeing none, we'll move on to item 3, which is the approval of the November 3rd, 2021 Health and Human Services Committee meeting minutes. They were sent out in advance. Are there any additions or corrections to the meeting minutes from November? Seeing none, a motion to approve would be in order.
Supervisor Harris with the first motion.
Okay, I have a motion. Do I have a second?
Second.
Okay, a second from Supervisor Van Cray. Any further discussion? Seeing none, all in favor say aye.
Aye.
Aye. Opposed? That motion is carried. Thank you. Item 4 then is the policy issues discussion and potential committee determination. We do not have any in that area today, so we'll move on to item 5. Operational functions required by statute, ordinance, or resolution. 5A is approval of the 2022 Elderly and Disabled Transportation Grant Application, better known as the 8521. We do have Dave Mack with us today to speak toward it. This was through the Transportation Coordinating Committee a couple weeks ago, and was passed unanimously there. Dave, if you'd like to say a bit about this to tee it up for us today. No. There you
Hey,
go.
now it is. Thank you. I guess I'll stay seated.
take this off probably to speak better. Thank you, Mr. Chair. Again, I'm Dave Mack. I'm the planning manager for Marathon County at the Conservation Planning and Zoning Department and help administer this program for the county. I have for you today an application for the Elderly and Disabled Transportation Program. We receive funds from the State Department of Transportation in the form of a grant to provide rides for the elderly and disabled in Marathon County. This application is also known as the 8521 program. That is the state statute that governs the way that this program is administered throughout the state. In your packet for you today is the application that we will be sending on from this committee onto the county board for their approval, and then on to the state for their approval as well. In this application, we will be receiving for 2022 about $362,000, and we have budgeted for the 20% match that's required for this, which is about $72,000. And in the program, if you look at the summary page that's in there, we have, with the combination of the two entities that we use to provide the rides for the Marathon County citizens, we use the North Central Healthcare System as part of the program. They provide rides throughout the whole state, or the whole county. And then we use Metro Ride, which provides rides within the city of Wausau as well. With those two entities working for us, we have a program totaling about $660,000 worth of program that we administer to provide rides for those citizens. The application, like I said, is in your packet. It's pretty sparse. It's an online type of an application, so there isn't a lot of detail that we need to provide for the state. But I'm here to answer any questions if anybody has any, and I'm here to ask for your approval to send this application on to the county board.
All right. Are there any questions for Dave Mack? Yes, go ahead, Supervisor Krause.
Thank you. Thank you, Chair. I see that there are 7 bus shelters that are 5 being replaced, and I think there's an additional 2. And I was wondering, are you able to tell us the location of those 2, the 2 extra ones? And I'm assuming they're new ones. And then why 7 instead of like 9 or 10?
So in the application, we have established some funds through. If you read the application, you'll realize there's a trust fund component to this. There's monies that the county has not spent in the program in previous years were able to be put into a trust fund. And in that trust fund, we're now this year going to be using those to buy some bus shelters in the city of Wausau as part of the Metro Ride system. We've identified that the purchase of 7 bus shelters on 5 routes that they have. And those, I don't have the exact locations for those, but all we're doing is replacing the existing shelters that are there now with shelters that are going to be ADA compliant. Right now, the shelters that we have are not compliant, and so we need to remove those and then replace them with something that's new. So I don't have the exact locations, but I know that that's part of the application, is to spend dollars to replace and not purchase new, if you will.
Okay. You have a follow-up, Supervisor
Yes,
Krause.
I have a follow-up question. Was additional bus shelters in consideration at all, or it just was not considered at all?
At this time, additionals were not considered. It was just the replacement. Because those shelters are on private property, we did not go to the lengths of trying to identify new locations to establish new shelters at this point in time.
Thank you.
Okay. Other questions from other committee members?
This is Supervisor Van Cray.
Yes, Supervisor Van Cray.
Dave, do you happen to have the numbers or know an average of how many riders these two programs serve annually?
Oh boy, annually.
Oh, if you want to give it in a different monthly, you can do that too.
Can you repeat that last part?
In a
I
monthly
said if you wanted to
basis.
give it monthly.
Oh,
or
yeah. I
weekly.
think on average, boy, I'm trying to remember back to our last meeting and what we heard from both the entities. I know the Metro Ride system is probably providing about 1,200. I'm looking at Tim to help me remember. And I guess I'm not sure. The North Central system is a lot more because they provide rides.
Mhm.
Hey, look at this. Oh, I got numbers. This is from the Metro Ride system, and I'm just looking forward here. The county-wide program through North Central provides a lot more rides than the Metro Ride system. Actually, what I'm thinking about, I'm not seeing anything that I have right in front of me for the amount of people that we use for that particular program.
Mhm.
So I'm not sure what I'm looking at from your notes, but yeah, thanks. Anyway, I'll have to get back to you on that specifically, but it's, boy.
Yeah, Supervisor Van Cray, at the Transportation Coordinating Committee, that Metro Ride does provide numbers for us on a quarterly basis. And obviously during the COVID period, numbers were definitely down as far as ridership goes. So that's about all I can tell you right now. I don't have those exact numbers
Yeah.
in front of me either at this point. So Supervisor Krause, one more time.
Yes, those answers to those questions were also given at the City of Wausau Transportation Committee meeting. And the first highest of Metro Ride, the bus system riders, were children, students. And then the second was adults who were disabled and elderly, of course, anyone who's disabled and elderly. And then the third were adults, just the general population adults. And I had those numbers too, but I don't have them with me. And I was thinking it would have been nice to have had Greg Soybert here so he could have maybe answered some of the questions, the more detailed questions too. Thank you.
Well, he was present at the Transportation Coordinating Committee meeting, and we need to address specifically the grant money here on this particular subject. This is what we're looking forward. One more time, Supervisor
Okay.
Krause.
And also I wanted to say that with the relaxation of COVID in the spring and summer, that's when bus ridership increased greatly in all the areas. And then because of Delta again and now Omicron, it's gone down considerably. Thank you.
All right, thank you for that. Other comments from committee members?
Supervisor Conring, I have a question.
Go ahead, Supervisor
Ballpark,
Gottlieb.
what capacity are the buses being run? Are they 50%? I know it's hard to say because people are getting on and off, but are they just questioning if they're being used?
Go ahead.
If you, right now, we're talking about the Metro Ride bus transit system in Wausau as the fixed route system, and I just wanted to make clear that that particular program is not part of what we're asking for as part of the application. The application process provides Metro Ride monies for what they call their paratransit service, which does provide rides for the elderly and disabled, but it doesn't deal with any of the fixed route system that's out there. So right now, I think that the capacity for the fixed route system is down because of some of the COVID concerns that are out there. In the past year, they were only allowing 10 people on the bus at any point in time during the height of COVID a year ago, and so the numbers have been down over the last 2 years, definitely. because of what's been going on.
Other questions from committee members? All right, then seeing none, a motion from the committee would be appropriate to approve the grant at this time. Supervisor Krause, is that a motion? to approve?
Yes, I make a motion to approve the grant.
Okay, that's a motion to approve. Is there a second?
Supervisor Godring, I second the
Okay,
motion.
Supervisor Gonring with a second. Any further comment from committee members? And you in the back, the public, I'm not sure, you're not a member of our committee, correct? So, all right, you're from city council. You're not a member of this committee though, however. So the public comment section was earlier in the meeting. So at this time, it's a committee meeting, all right? Well, the public comment section was at 4 o'clock, and that's, there was an I asked for public comment, and there was one public comment. Well, the meeting started at 4 o'clock. I'm sorry. At this point, we have a motion on the floor. Did we get a second? You did. Okay, we have a second. Any further discussion on the motion? Seeing none. Then all in favor of the motion to approve the 8521 grant application, say aye.
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 Opposed, same sign. That motion is carried. Thank you.
Not allowed comments. I'm here. Not allowed to comment.
All right, we will move on to item 5B, which is the update on strategic plan objective 7.2 progress by staff. And with us is the health officer from Marathon County, Laura Scudieri, and to give a presentation. Thank you.
Okay, I turned it on, so we're good. Hi, I'm Laura Scuderi. I'm the health officer here in Marathon County, and I'm here to.
Can't hear you. Speak clearly and slowly and distinctly, please.
I would ask you please not to disrupt the meeting, all right, at this time.
I cannot hear her.
You can hear me though, correct? Please do not disrupt the meeting. Please do not disrupt the meeting. Thank you. Go on.
Okay, we'll turn up the volume. Yes. This way. I'll also move it closer to my mouth.
There you go.
Okay. All right, so today we're going to be reviewing Objective 7.2 in the strategic plan, which is about drug misuse and abuse. And I just want to mention that drug misuse and abuse is a top priority for Marathon County government, and it was identified as an objective in the 28.
Speak slowly and clearly.
Ma'am, if you're not going to allow us to continue with the meeting, I'm going to ask you to leave, all right?
I have disabilities. I'm asking for accommodations. Please speak slowly and clearly.
Why don't you sit a little closer then, please? There, you can sit. If that'd be helpful.
It's all mumble back here.
Okay.
Just sounds like mumble.
I don't think it, I would prefer to keep it on, thank
Right.
you. So individuals, families, and communities are experiencing the impact of heroin and methamphetamine epidemic in terms of it eroding and disrupting the lives of children and their families, decreasing an employable workforce, affecting the overall quality of life, and increasing the financial burden on county government to provide child welfare, law enforcement, and justice services. So I thought I'd begin by giving a quick overview on some of the data that we have currently. This,
Where's your copy so I know what you're talking
I do have a copy. Hold on, I can get that for you. So this data is from our Marathon County Pulse data. So this is data that is updated and it is maintained by the Health Department and the Pulse platform. you can see that our age-adjusted death rate due to all drug overdoses is just a little over 10 deaths per 100,000 in the population. So it is small. It is actually down compared to the Wisconsin value, and it is on a slightly downward trend. Of course, I wouldn't use 2019 or 2020 for comparison data at this time, but I thought it would be worthwhile because of COVID. COVID did interfere with data collection, but I thought it would be good for us to have some data as a starting point. So this is from Pulse. This is the age-adjusted death rate due to opioid overdose. And you can see there was a small uptick in 2020. And again, this is just the deaths that are due to residents overdosing from opioids that are Marathon County residents. So individuals that are from different counties are not counted in this data, who have passed or overdosed on Marathon County land. And then this is the drug overdose deaths. So this includes all drug overdose, includes prescription drug overdoses. And you can see that the trend is up compared to the prior value. And again, this is Pulse data. So this can be found on the www.marathoncountypulse.org. And you can actually, there's all kinds of different health indicators there. If you have not gone to that already, I'd recommend going in there and familiarizing yourself with it. It's a really great resource. This data is from the Wisconsin Interactive Statistics on Health, which we call the WISH data. So this is strategy, this was developed into various strategies, and the first strategy was strategy A. It was about developing a comprehensive approach to address the use of heroin and meth, and giving you a current state of where we're at with that is that COVID has really had an impact on local programming, and it's really reduced availability to treatment options overall, as well as prevention options. I did speak with the CEO over at North Central Healthcare, and it's due to a variety of different reasons, COVID and their building plans, their construction plans, it really has impacted North Central's ability to serve medically monitored treatment clients. A medically monitored treatment program, that was the inpatient program in our area. And there is no other inpatient program to assist people with substance use disorders in our county. There are outpatient and day treatment and outpatient availability. The day treatment program at North Central Healthcare has been closed, and so has Driving with Care. But they do continue to serve outpatient and community treatment patients through those programs and help them with their substance use needs. And I do want to mention that North Central is the one I was able to speak with. There are a variety of different programs in private counseling agencies that have some combination of treatment options that may or may not be continuing at this time. Also, I should mention that North Central Healthcare's hospital, when it opens, when it reopens, it's going to have 5 detox beds, which will be a great opportunity for us. And their medically monitored treatment programs will be able to admit up to 14 clients, and they expect this to open mid to next year sometime. Is that right? We're hoping. Okay. And so I do want to just comment that I believe that the relationships between the partner organizations that have initiatives toward treatment or prevention, those partnerships remain strong. I just want to make sure that everybody understands that COVID has had such a drastic impact on all programming this year that it has really impeded our ability to move forward on a lot of these strategies. So strategy B is to complete an inventory of programs, services, and community initiatives in relationship to best practices led or supported by Marathon County government that contribute to mitigating and preventing drug misuse and abuse. So the current state, our former health officer, Joan Toyer, worked with community partners and her staff to ensure that there was a evidence-based practice and public policy review. And it also outlined all the current available services and gaps in services for treatment. The vast majority of best evidence practice reviewed were practices reliant on partnerships. So Marathon County government and other public and private sectors like EMS, schools, Marathon healthcare organizations or businesses. In that document, Joan Toyer did make recommendations that Marathon County really, it would be in their best interest to understand the scope and complexity of this issue. The issue of how heroin and meth impacts our community is very complex. And then the treatment pieces and parts are very complex. And so it would be in our best interest to have a better understanding of the potential benefits of investing in this issue and have awareness of the initiatives that are underway. So this is the last strategy here, strategy C. Or no, it's not the last one. A couple more. So identify gaps in programs and services and community initiatives and opportunities for public-private partnerships in efforts to mitigate and prevent drug misuse and abuse. And again, this is I believe that the work that Joan Toyer put into identifying gaps in programs and services done in 2018 was very comprehensive. However, COVID has drastically changed the environment, the treatment environment as we know it. And so I believe that that document at this point is largely outdated. And if we redid it, you would find that there would be gaps in service where there weren't gaps in service before. Any gains that we made in services may not have been retained. And we may have new gaps in service that we didn't have before. And this is because, due to COVID, agencies have really had to reprioritize. We've all had to change what was the priority issue because of the urgency of COVID. Strategy D, identify and advance public policy that would support the mitigation and prevention of drug misuse and abuse. So Joan Toyer, our former health officer, did talk with different legislators and individuals and partners about drug courts and what drug courts might mean for our county. The notes that I found indicated that no progress was made at the time to expand the number of specialized courts in Wisconsin, and that in 2019, that the conversations were ongoing. So the recommendation that I have today is that we reevaluate the policy strategy. I think it would be worthwhile to completely approach that from the perspective of the worldview we have today. Strategy E, identify and track data points to measure the impact of drug misuse and abuse among residents of Marathon County. So as the current state, we're using, Marathon County Health Department is using results-based accountability framework to essentially what is we call in the framework turning the curve. So what that essentially means is that we choose a measurement, the partners, anybody involved in this process chooses a measurement in which we could make an impact on. And then the key stakeholders get together to see how they might make an impact on that specific measure. So I can tell you that the Board of Health and the Healthy Marathon County recently identified outcome measures, and they also identified the key health priorities. Substance use was identified as a key health priority. And the next step in the process will be for key stakeholders to convene and decide on actions that will make an impact on these agreed upon outcome measures. In addition to that, the results-based accountability turn the curve process also involves developing a data collection plan. So these are the outcome measures that are listed in the strategic plan. By March 1st, 2019, an outcome measure will be established to measure the quality of life for adults in counseling, mental health, or AOD-related treatment programs. This is an interesting measure because I actually worked with Joan Toyer on this when I was the executive at North Central Healthcare. We felt very strongly at North Central Healthcare at the time that this was a more accurate measure of whether or not our programs were making an impact on people's lives. And part of the reason why we don't just track sobriety is because sobriety tends to change. Relapse is part of treatment. And so sometimes it takes people 5, 6, 7 times in treatment in order to actually maintain sobriety. So the question is not, are you sober? The question is, are you more able to meet your treatment goals? And so that's where a quality of life measure would have been more effective. It's also evidence-based practice for treatment programs of a quality of life measure. So I'm not sure where North Central is at with that at this point. Again, I think COVID has really dominated the conversation of what outcome measures they're really focused on at this point. But I will continue to work with North Central on this. And then the next one, 3% or less of high school students in Marathon County will report on having taken prescription drugs without a doctor's prescription 1 or more times in the past 30 days. And this is the data, and you can see we are not near it. There's a lot of work yet to do on this. And in our data that we have in 2019, 9% of high school students took prescription drugs, or self-reported taking prescription drugs. And then the last one is, by December 31st, 2022, the rate of overdose deaths among residents in Marathon County will hold steady or decrease. And as you saw on slide 4, there you go. So we have some work yet to do in order to keep it steady or decrease it. And that is, and does anybody have any questions?
Any questions for Laura?
Yes, I'm the question person. Thank you. I was just wondering if you ever measured geographically the areas in Marathon County where there is more illegal drug abuse, if there's any chart on that. And then I also have a question is, for the people that you're treating, do you have any numbers on how many come in voluntarily, how many are ordered to by the court system, and how many are in jail that are in treatment for drug use? Thank you.
I'm going to take the second question first, if you don't mind, because so I don't have any numbers with me today about whether or not somebody voluntarily, what percentage voluntarily goes into our treatment programs, because there are so many treatment programs out there. There's not just North Central Healthcare. There's, Compass Counseling has some, and Center for Wellbeing has treatment programs. So it's not just county-based organizations that do treatment programs. I can tell you from my experience when I was at North Central Healthcare, it really depended on the program. And it was really, there was a socioeconomic divide. So individuals with a lot of resources tended to be able to go to a rehab facility in California. And then individuals with lower socioeconomic status would tend to have whatever resources would be available to them. And in our county, at the time, we had medically monitored treatment program, we have outpatient counseling available to them, and then we had day treatment. Now, that was 2 years ago. I started with the health department right when the pandemic hit. So what has happened since then is our medically monitored treatment program is not operating right now, and our day treatment program is not operating right now. And so the options for people, especially people of need, are much less. Does that answer your question?
Yes, but it brings up another question.
Okay.
And the other question is during COVID, I heard that there was, or read that there was a huge increase in drug overdose and drug usage, illegal drug usage. So I'm wondering, why would it be that the daycare and the other treatment centers for drug use would be closed at this time?
Yeah, it's a really great question, and the reason is because, it really depends on the agency. So if you're speaking to North Central Healthcare, I think it would probably be best to ask them exactly, what happened. But if I was to guess, COVID took precedence and priority, and keeping the staff and the patients safe was the priority and the urgency. I think that there was also, I know North Central Healthcare was also doing some construction, and so they couldn't keep certain programs open during construction. So it's not a ideal situation by any means.
Thank you.
If I may, Mr. Chair, this is Administrator Leonard. I just want to add a little bit of extra context. Laura gave you a lot of information today, and we don't expect you to, quite honestly, do anything with it today. But in terms of context, the reason you're getting the update relative to Objective 7.2 of our strategic plan is because this committee was identified as the lead county board committee with respect to progress on the strategic plan objective that the board approved, which is one of those 12 was 7.2. The reason Laura's before you today is because her department, the health department, was identified as the lead county department in terms of monitoring our progress relative to the strategic goals and the strategies that are laid out in that document. Laura's department is not responsible for making progress on that objective. As you see from the document, and if you, it's available online, you guys have referred to your strategic plan a great many times, and I'm gonna share in just a moment the annual update that we did on the strategic plan. But a lot of our departments, a great many of our departments, all have the opportunity to move the needle in, as it relates to each of the outcome measures set forth within that objective. And I'll add, so that's the why it's before you. And how county board, all of the questions that I have no doubt you're interested in that relate to the specifics of how these programs operate, they're very interesting. But again, the board is a policy board. The policy question for all of you is one, in my mind, of resources. What resources do we bring to bear on all of the issues that we're talking about in Objective 7.2 and Strategies A through E? What resources does the board marshal to move forward on those? Staff are doing a lot of the things that are within, in the document that I'm going to share in just a minute, if I can jump up here. I'll talk as I open up the internet and share a document. Let's see here. Staff are doing a great many things. And those were documented within this strategic plan annual update that was released in 2020. So how you find that is if you go to the Marathon County website and you go to the Excellence tab at the top and you click on Strategic Plan, you'll have the opportunity to click 2020 Strategic Plan Update. And a lot of the information that Laura provided to you, kind of the backstory to that information, is on begins on page 17 of 37 with the document that you're all very familiar with. That is the template for our strategic plan. When you start to think about progress, I want to, again, just give additional context here. We did a lot of work in 2018 and 2019 that's set forth in this document. Like Laura referenced, we had our Lakeside Recovery Program, which is the medically monitored treatment program operated through North Central Healthcare. We expanded the capacity at that program from 6 to 14. We expanded the capacity with our community-based residential facility, commonly referred to as a CBRF. We expanded inpatient, intensive outpatient, or IOP, and day treatment. Community treatment was expanded. A lot of things through North Central were done to expand access and increase the continuum of care that we had for individuals. A lot of good things, and in fact, this board approved even more things, which was the construction plan that continues to be done down at North Central to renovate those spaces to make them more amenable or useful for these programs to operate out of. As Laura referenced, and as you're all very familiar with, 2020 and 2021 has been a challenge relative to the pandemic. And as Laura referenced, a lot of those programs were shut down. Initially, they were shut down because we were ordered to shut them down. If you think back to a time when I'm sure everyone doesn't like to think back to, but there was a lockdown order for a lot of programs. And the advice at the time and the directive at the time was to limit gatherings. What intensive outpatient and what day treatment are group therapy programs. So we transitioned resources from those group therapy programs to outpatient counseling programs, and we did that in different ways. Outpatient counseling we all became familiar with telehealth, more familiar with telehealth than we were before. So that's a little bit more of the backstory, again, on why this information is here. Now I want to talk a little bit about what are the next steps for this committee. As I said, really the policy question moving forward for this committee to think about relative to the strategic plan over the next several months that you have, this term still exists. What do you want to focus on? And that's the question for you. Your largest policy document, the most important policy document you pass every year, your budget, was just approved. That allocates resources to the things that matter. The question for you now is, again, to start thinking about what do those allocations look like from staff. The direction we have right now and the direction we've received from the board to this point is really finish a lot of the work we started in 2018 and 2019, and that's what I referred to and what Laura referred to. Our work at North Central Healthcare is far from over. We are expanding the inpatient hospital component of the services that we deliver, increasing the capacity by allowing for individual patient rooms as opposed to shared rooms, which allows us to provide better care to individuals, but more importantly, or equally importantly, I should say, is that it allows us to provide care to more people. When you have 4 individuals sharing a room or 2 individuals, if one of those individuals their condition is such that they are unable to be around other people without one-to-one staff supervision, you cannot fully occupy the room. You can't have 2 people or 4 people there. So oftentimes what North Central had to deal with was diverting people, and what that means is we're sending people from a local institution to institutions used by the other counties throughout the state of Wisconsin, namely Winnebago and Mendota. So they're leaving our community, law enforcement are transporting them, and then they're having to come back once their treatment is completed. The new design at North Central is going to decrease the likelihood that we need to do that. We're still going to need to do that on occasion for treatment needs, but it should decrease. Similarly, we expanded the continuum of care for youth with the building of the youth inpatient hospital and youth CBRF. So a lot of opportunities, we need to continue to move those forward. You know, COVID has been the curveball of curveballs, but you know, we need to continue that progress, and I think we're doing that well. I also wanted to make a couple of updates to you. It's alluded to in this document, but Marathon County has a very active, as it relates to one of the measures Laura referenced, overdoses. Marathon County has a very active and collaborative group of professionals from the treatment side and the criminal justice side, our medical examiner, law enforcement. It's called the Forensic Overdose Review Team. And what they do is each of those unfortunate instances where an individual dies as a result of their use of a controlled substance, we review the circumstances of those and try to identify what systems issues could be improved to mitigate the likelihood of a similar instance moving forward. And I think that's a really important thing to reference that we're doing. The other thing that is not in this annual update that we've continued to make progress on despite the struggles with the pandemic is the idea that we need to have data measures, and that's one of the strategic plan objectives, or excuse me, the strategies that's under 7.2, right? This important idea that we need to know how are we assessing our progress, and how are we assessing how much of something we're doing, how well we're doing it, and third, is anyone better off? And our criminal justice system has a number of projects, and Dave Mack is here. He's working with Conservation Planning and Zoning as the lead department to facilitate our work with the University Year Program. And you guys have heard me talk about that before. But a number of the programs that are or projects, I should say, that we're looking at, through our work with the University of Wisconsin-Madison and the University Year program, relate to that idea of data. Are we measuring what matters in our criminal justice system? We're specifically looking at our operating while intoxicated treatment court, our OWI court for individuals that are on the doorsteps, would otherwise be heading to prison for their drunk driving convictions, providing treatment, focusing on treatment and keeping them here locally to provide that, and very close monitoring by our justice system. Are we measuring what matters there? Are we being effective? Similarly, our drug court, Laura made reference to this. We have a drug court in Marathon County, and it actually is a relatively unique drug court in that it actually targets a population. We all know that there's a large number of people in our criminal justice system and in our broader community that need drug treatment. That said, we don't have unlimited resources to provide the same level of highly intensive treatment to everyone. So we looked at our drug court and we identified a population, again, individuals that would otherwise be on their way to prison, but also we looked at other areas within the county government and county departments where we see the impacts of heroin and methamphetamine, and it's in Corporation Counsel's office and social services through their prosecution of cases involving children in need of protection or services. So we put in place a program that really seeks to target and prioritize those individuals to get into that treatment program. It's not limited to those individuals. It takes others certainly as well, but it gives a second look to those individuals because in a sense, the county's paying twice. It's not only a drug court targeted at individuals that are up in our jail, committing crimes and going through the criminal justice system, but it's also targeting individuals that because of their criminal justice system involvement are unable to parent their children safely, so we're paying to place their children either with relatives or in foster care. So that's the way we set up our drug court. It's been successful in my assessment, but again, that's my assessment. Our University Year program project is seeking to make sure that we're measuring what matters and we're having positive outcomes. So that, in my mind, are the next steps from staff. We're going to need to continue to do a lot of the work that Laura said. I think it's absolutely true. We need to go back and reassess what we did in 2018 and take another look. But that's an issue of resources right now. Like I said, the department that was identified as the lead department by the county board to address this issue was the health department. And the health department is tackling another public health pandemic beyond epidemic. If you would have asked me 2.5 years ago, if you would have used the word epidemic that the county's facing, I would have 100% understood you to mean the drug epidemic. You use the word epidemic, I'm thinking pandemic today. But they're busy doing that. So how do we make sure we have the resources necessary to do that additional evaluation? Those are going to be questions we have to look at from my perspective on the operational side, but also on the county board side. Is that a priority? Because I fully recognize that there are other priorities that the board needs to address as well.
Well, Lance, my question would be then, okay, for our committee then, would it be appropriate to take a look at this on like a quarterly basis to see what kind of progress we are in fact making, if any?
I think that's a great idea. Sorry to
Yeah, no, go ahead.
I think the core piece to that is changing the way that we have discussions about our programs. And this is not unique to the programs and services we offer under Objective 7.2 or that Impact 7.2. It's across the board at the county. Having a true sense of the three things I talked about. How much of something are we doing? How well are we doing it? And is anyone better off? We don't have, and Marathon County is not unique. There are very few counties across the country and very, very few within the state of Wisconsin that have, as far as I know, a data dashboard that really has good metrics as to those items. It's hard. And quite honestly, the county board has identified We talk about 12 strategic plan objectives. You have well over 50 in your comprehensive plan, and they're all important. And when we try to focus on a lot of things, we have very limited time to go back and collect data and analyze data, because at its core, that is work. We don't have across the entire county, we do not have a data analytics person. But brace yourselves, you're going to be seeing that in the 2023 budget. I can promise you that.
Wonderful.
A new position will be in there for data analytics. I just don't see how we don't have one. We've been talking about it in the criminal justice system since I was working in the DA's office, and that was far longer ago than we need to talk about today. But to your point, we need to find a way to engage the county board on that, to get you the information you need to make the decisions that you need to
Well,
do.
and
And I think
where to allocate resources.
Right.
That's really the key
yeah,
here.
and it will help staff, quite honestly, know where we're having an impact and where we're not. Right now, I think we're doing a really solid job. When I look across my peers around the state, I think we should be proud of the work that we've done, and our strategic plan is a plan that others have not only emulated, but they've flat out copied it. I've had multiple administrators reach out to me, and in fact, I most recently had it was from a county in Florida calling me, and they were just wowed by our strategic plan and wanted to know how we did it. But we do need to take that next step in my mind of how do we identify what are we measuring what matters, and how are we getting actionable data? Because I'll use an analogy. A great piece of data that many people get every day, including myself, is you step on the scale every morning, right? And that's helpful. However, you need to have a target of what that number should be. And that we also need to do some work there, because, for example, if I step on the scale in the morning and I read the number and say, oh, I'm not at my target, there's a fundamental difference between being 3 pounds away from my target and where I am currently. The response is far different. And we need to know, pick a program, whether it's the Start Right program or our OWI or drug court or our CHIPS prosecutions. Where are we? Are we at or better than target? That's great. Are we 3 pounds away, or are we more? And then we need to have more, then we'll be making more informed decisions about what to do in response. But
Right.
that's a long way from where we are.
Yeah. I'd limit that scale thing to maybe weekly, though, rather than daily. But questions or comments from committee members, please.
And if I may, Mr. Chair, if anyone has any trouble finding the strategic plan or the strategic plan update from 2020, I'd be happy to send those to you or direct you to them. But again, they're on the county website if you go under the Excellence tab and then click Strategic Plan.
All right.
Supervisor Seibert here with a comment.
Go ahead, Tom.
What is drug enforcement? I mean, once an addict gets to the level that we're talking about, I think we failed the system, where we've got to look at getting the drugs off the market. I mean, in this country, we can't keep drugs out of prisons, and we can't keep them out of schools. And I think that's where we need to step up is get these kids before they become addicts. And hopefully, I just think we need to send more money towards the sheriff's department, towards the district attorneys, towards enforcement. And hopefully someday maybe we won't need these rehab centers and this type of thing. That's all I have. Thank you.
Okay, thank you. Any other comments from committee members?
Supervisor Harris.
Go ahead, Will.
Administrator Leonard.
You might want to speak up a little bit. You're coming in pretty softly.
Okay, I'm sorry. So Administrator Leonard, one of the programs that you mentioned going through that has been successful is the drug. And you mentioned going through data points. Um, should one of the questions, I guess, be for our committee, once we receive data points, not just more, but also looking at expansion of a program like the drug court that has been successful?
Yes, I agree with you. And I'm not to be glib, but I completely agree with you that, you know, there's the question of, you know, where are we? What's the impact we're having? Should more resources be allocated to something? The one thing, and I probably wouldn't have said this 2 years ago, but I'll say it now because I think it's real, is that we also need to have a very honest and transparent conversation about, do we have the people resources to do the things that we want to do? Your example about drug court. Right now, we have a judge, 6 judges in Marathon County that, if they were before you today, they would say they are exceedingly busy, and I'm not going to argue with them. Our district attorney's office is exceedingly busy, and any treatment court that you operate they're a lot of work. And similarly, we need to have a lot of resources for the treatment providers and treatment professionals to participate in those courts. And we're starting to see, now this is my assessment, but we're starting to see, you know, there's a real issue across the board in all of our departments about, even if we wanted to expand programs, and you're seeing this at North Central as well, even if you want to expand programs, do you have the staff to do it? This is, again, going back to a conversation, just as an example, the conversation that was had at this committee relative to the operation of the nursing home. Jarrett Nickel from North Central came and talked to you about, you know, what is the appropriate bed licensure for North Central. And remember, one of the things that he talked about was the ability to staff the, even if the right number were higher, do you have the staff? Can you afford the staff to do it? So the short answer to your question, of course, is yes, that should we be looking at expanding programs that are having a high return on investment and having a high impact on the community? Absolutely. And we should withdraw perhaps some resources from programs that are not as successful. And I can say honestly, I don't know that we've been as active on the taking things off of our plate as we have at adding things to our plate. We're really good at starting new programs and bringing up new programs, and it's been my experience that it's additional work for staff, which is understandable, but we need to do a better job of saying what can we stop doing, because we don't have unending resources in terms of staff or money.
I think that's a good point. Other comments from supervisors? Supervisor Krause.
Thank you. I had heard that the program where a police officer goes into the schools, I think it was the DARE program, where they talk to the students about drugs and, turning away drugs when they're offered to them. I've lived in areas where there were fellows who actually went into the playgrounds by the schools and enticed these pretty looking cute little pills to the children just to take. And I've also heard that when this police officer went into the school to talk about drugs, somebody had said to me that in drug families, kids who hear that know people who are using drugs, they just think that's so ridiculous. And they laugh and they jeer and they think that is just crazy, that somebody would come into the school, police officer. It's just a culture, and this culture is brought up through different kinds of music and, bars and things like that, where all of this, recreational fun use goes on, and especially children and high school students are so gullible and easily persuaded to go along with the crowd and get along. So I think it's just a culture that needs to be changed too. And it just seems like a problem that would perpetuate itself until we address some of those issues, as a previous supervisor had mentioned. Thank you.
All right, thank you. Any other comments? All right, I think we'll move on then. Thank you both for speaking today toward this subject, and look forward to hearing more about progress and anything that we can do as a committee to help fund or take a look at things and help facilitate going forward. We certainly be willing to listen to that. So let us move on then. Item 6, we don't have any educational presentations today, although that was that maybe should have been under that one, I don't know. But item 7 is next meeting time, location, and announcements. Committee members are asked to bring ideas for future discussion. We have talked about ADRC, and that is something we will likely have either in January or February next year. We're in the process of looking for a new executive director for that, so they're kind of swamped right now with just making sure things are getting done appropriately. But any other ideas, please bring them forward to me. Next scheduled meeting is January 5th at 4 o'clock. That's on a Wednesday. So that's all we have for today.
I think, if I may, Mr. Chair, I believe there's been discussion between yourself and Supervisor Boots from Public Safety about having a joint meeting.
There has been.
So you
Yes.
may have a meeting, and we'll finalize the time, but it may be a little earlier than your meeting would be otherwise scheduled, because Public Safety meets at 1:30.
Right.
You meet, of course, at 4, to have a joint meeting between those two to address a topic that applies perhaps to both of the committees. But we'll finalize that time. I don't know if you and Supervisor Boots have finalized it as of
We
yet.
have not finalized it. There's just been a suggested time at this point, but you'll see more on that as we get there. It would be that day, though, I believe, would be the 5th. So, but it may be earlier. So, anything else for the good of the order? Seeing none, a motion to adjourn would be in order. Supervisor Krause, I'll accept that as a motion to adjourn. Do I have a second?
Second.
Give a second from Supervisor Van Cray. All in favor say aye. Aye.
Aye.
Opposed, same sign. That motion is carried. We are adjourned at 5:02. Thank you.